A snapshot of the nation's sexual health paints a very unhealthy picture. The annual report card found a massive jump in chlamydia and gonorrhea, particularly in young people. Doctors are calling for better awareness and prevention programs to stop the infections increasing. Medical reporter Sophie Scott has more.
Educating people about safe sex has never been easy, and now it seems many young people are not getting the message. The latest report card on the nation's sexual health shows infections like chlamydia are rising.
We've seen over the last 10 years a very substantial increase, and over 74,000 people in Australia were diagnosed with chlamydia in 2010.
That's up almost 20% from the previous year. Most people with the infection will have no symptoms, but if left unchecked, chlamydia can lead to problems such as infertility.
We are seeing an epidemic. The epidemic is particularly among young people, among both males and females, between the ages of about 15 to 30.
Experts say many are not heeding safe sex messages and want to see more targeted prevention programs.
We are seeing increases in syphilis, in chlamydia, in gonorrhea. All of these infections need to be protected, and the best way of doing that is through condom use.
Indigenous communities are particularly hard hit, mainly due to a large pool of existing infections and a young mobile population.
36% of all the gonorrhea in Australia was notified among Aboriginal and Torres Strait Islander people.
But there was some good news. HIV rates have remained stable with around 1,000 new infections a year.
The makeup of that number changes somewhat. We're seeing more heterosexual infections than we did early on.
There's more good news too, with rates of the human papillomavirus decreasing since the introduction of the cervical cancer vaccine in 2007. Sophie Scott, ABC News.